Learning about asthma can be the hardest part of asthma care. What treatments to give, when to give them, what are your child's triggers, and how to avoid them? What other steps can you take to help your child? You have a kid with asthma? Well, do not be discouraged and learn as much as you can. Let me help you with that in this video. Hi, I'm Dr. Kristine Alba Kiat. I'm a board-certified pediatrician, and my mission is to help moms and dads deal with child health problems to raise happy and healthy kids. In this video, we will talk about ways that you can do to help manage your child's asthma. We will also talk about how to recognize an asthma flare. Is it a mild flare or a severe asthma flare? When is it an asthma emergency? Managing your child's asthma. First step, have an asthma action plan. Now, what is an asthma action plan? It is a written instruction from your doctor that provides clear step-by-step directions on what to do, what medicines to give to your child, and when to give them. It also includes avoiding triggers for your child, and it also includes what to do during a flare-up and how to manage an asthma flare-up. By learning about your child's asthma action plan, you will learn how to live with your child's asthma, and you will also know how to recognize and manage an asthma flare and know when to worry and call the doctor. If your child doesn't have an asthma action plan, work with your doctor so that your child can have one. Tell your child's teachers that your kiddo has asthma, and also give them a copy of the asthma action plan. Next step, take the medicines correctly. Some kids with asthma need to take medications. One type of medication is given as a daily medication, and these are known as long-term controller medicine. These are given to keep your child's lungs from getting irritated. Then, another type of medication is only used during an asthma flare-up, and these are known as quick relief medications. Your child's asthma medicines may be given through a nebulizer or an inhaler. Your child may also have asthma medications that come in chewable tablets. Your doctor should teach you how to use them correctly. Now, make sure that your kids take the medicines correctly and you give it to them on time. Also, make sure that your child's inhalers are not empty. And if you're not sure how to give your child's asthma medicine, then ask your doctor right away. Next step, identify and avoid your child's asthma triggers. What are asthma triggers? Well, triggers are things that bother and irritate your child's airways, which can lead to an asthma flare-up or an asthma attack. Common triggers include allergens such as pollen, molds, also changes in weather, and viral infections like the common cold. Identifying your child's triggers can take a lot of detective work, but it is important that you do that, and it is going to be worth it. Your doctor can also help you to identify your child's triggers by checking for allergies and testing for it. Now, when you know what your child's asthma triggers are, it's best that you help your child avoid them. Another tip, make sure your child gets a yearly flu shot. Now, all kids need to get their flu shots every year, especially kids with asthma. When a child with asthma gets the flu or influenza, it might lead to an asthma flare-up and can develop into a more serious disease. Now, do you want more tips? Do you know how to recognize an asthma flare-up? Is it an asthma emergency? Well, before we talk about those, do you have a newborn and are you interested in newborn care? Are you worried that you might have postpartum depression? Do you know what are the ways of soothing a crying baby? Are you having trouble with breastfeeding? Well, is baby colicky? What to do now? I have developed an online training video series known as the 5 Newborn Care Strategies. Do check that out with the link provided in the description section. Another tip is to use Asthma Tools, which can help predict an asthma flare-up. Asthma Tools include an asthma diary and peak flow meter. Now let's talk about an asthma diary. Asthma diary is basically recording your child's symptoms and putting in the date, how often these symptoms are happening, your child's need for medication, how often your child is getting these medicines. It can tell you what your child's early warning signs are, and it also helps your doctor know if your child's asthma treatment is working or if your child could need adjustment in his or her medications. Another tool is the peak flow meter, which is a handheld device that your child uses to blow air out of the lungs. It can tell if your child's airway is getting narrow and blocked, and it can predict an asthma flare-up. Next tip, know the signs of your child's asthma flare-up. When your child has had a few asthma flare-ups, you might notice that a flare-up is about to happen. Your child might look different, mood is different, breathing is different, or your child might feel funny. The signs of an asthma flare-up include coughing, throat clearing, fast breathing, your child being very tired or might have trouble with doing everyday activities, and also your child might have restless sleep, feel chest tightness or wheezing, or have shortness of breath. And then, you should know what to do when your child's symptoms may need medical care or even a trip to the ER or emergency room. Always have your child's quick relief medications handy and learn how to use it. Also, everybody taking care of your child, like your child's teachers and coaches, should know the asthma action plan for your kid and know when and how to give your child's quick relief medications. Call 911 or seek emergency care when your child has trouble breathing. Call your child's doctor if you have followed the asthma action plan but your kid is not getting any better. When there is new or worsening trouble of breathing, when your child has coughing or wheezing that does not get any better, when your child has been coughing up blood, or when there is a new or high fever. Also, call your doctor and seek an appointment if your child has been using quick relief medications more than 2 days of the week within a month, or if your child is not getting any better with the treatment. If you're a parent of a child with asthma, you might want to avoid a trip to the emergency room. But you should also know that your child might need medications quickly, and a trip to the ER is the right choice, and you should know when it is the right choice. Bring your child to the ER when you know if your kiddo has constant wheezing, if you have been using his or her quick relief medications quickly that don't go away after 15 or 20 minutes or return quickly, if your child has a lasting cough that is not responding to his or her quick relief medications, you should also worry about that. If your child's color is different, if you note bluish discoloration of the lips and fingernails, if your child has trouble talking in full sentences, And if you note retractions wherein the area below the ribs and between the ribs and the neck area, you see that it visibly pulls, these are known as retractions. And for all these symptoms, you should quickly bring your child to the ER. What you should also know is that many kids go to the ER simply because they don't have their quick relief medications on hand. Therefore, you should have your child's quick relief medications with him or her at all times, in school, during sporting events, and even while traveling. Hey, if you liked this video, watch my other videos where I teach you about other child health problems.